Good evening. Mike Stanley again, Friendship Baptist Church in Highland, Arkansas. We've had a little bit of a audio glitch tonight, so we're a few minutes late in getting started with our evening update. We hope that you'll bear with us and be understanding. We have some things in the works and in progress that we think will help smooth this out. This evening's report may be a little longer than some. It's going to be more heavy towards some news that, of course, it's changing every single day, and we're just kind of keeping you informed as much as possible. But first of all, tonight I want to read from the book of Titus, chapter 2, beginning in verse 11. For the grace of God that brings salvation hath appeared to all men, teaching us that denying ungodliness and worldly lust, we should live soberly, righteously, and godly in this present world. And here's the encouraging thing for the child of God, looking for that blessed hope and the glorious appearing of the great God and our Savior, Jesus Christ, who gave himself for us that he might redeem us from all iniquity and purify in himself a peculiar people, zealous of good works. Paul said, these things speak and exhort and rebuke with all authority, let no man despise thee. And tonight we certainly believe that as God's children, not only in the world at large, but specifically as believers in Jesus Christ, that this is a process of purification. We spoke to that last evening. We'll continue, I believe, to speak to that in the days ahead. I want to get to the news tonight. We know that our God is in control. And we also know that across this globe, like never before in human history, are men battling something and dealing with something that is beyond their control. There have been plagues, there have been pestilences, there have been challenges worldwide before, but never in an age where we had the instantaneous connection that we do in this present hour. Whether it's through social media, just the power of the internet, people in the furthest reaches of our globe are as up to date with what's going on as you and I. This news is changing rapidly. It's changing rapidly in our own community. It's changing rapidly in our state, in our nation, and in the world. And we just want to give you some thoughts this evening. I want to remind you of something we shared a couple of days ago. We brought up a topic, a phrase that goes back several hundred years in philosophical thought, Hobson's moral choice. And what this simply means is, and I want to remind you how it applies to our current circumstances, it applies that when there's two choices to be made that will bring different results. And what is the moral thing that guides a person, a leader, a nation to make one choice versus another? There's basically two choices in how the world is dealing with this, how our United States government is dealing with this, and even how our state and local officials are dealing with it. The first choice, which neither choice is easy, but the first choice would be to allow the pandemic to continue unimpeded and just simply allow it to run through our nation and through the world, and then we'd all develop, sooner or later we'd all get it, and those that survive would develop what's called a herd immunity, and then we would be done with it. The issue here is the literally millions and millions of people, and we're going to talk about that later in the population of the United States, how many are 60 plus, but millions would die. The second choice, also challenging, is the choice where our nation is now and where many nations of the world. That's to try and thwart it, to contain it by various things like lockdowns or quarantines, sheltering in place. The result of these two choices, either one, can result in catastrophic overwhelming of our healthcare system. The first choice, that's a no-brainer. That's a no doubt. Even with containment already in place in many nations, and here in the United States in many states, and lockdowns and such, we're still seeing healthcare systems overwhelmed. The second choice also brings another big problem, economic catastrophe itself, a shutdown, and our nation is in that. And so I just want to remind you that these are the choices that are before our leaders. I want to bring this really close to home tonight in a personal way. Dennis Horton, some of you from this area that grew up in this area, you certainly know Dennis and his family. They're our neighbors. I stopped and talked to him a few days ago, and he was out in the yard working, rolled my window down, and at that proper distance, they said, hey, Dennis, praying for you, hope you're well. And of course, he greeted me the same. And he said, Mike, I didn't know if you know, but my son Chad, has tested positive for this. I believe Chad was working on the East Coast in the Boston area. Chad is 46 years old, has been in good health, no underlying health conditions, and he's been on a ventilator. He came off the ventilator for a period and has told me this afternoon when I stopped again to roll my window down on the way to do this update, and he told me that how high his fever had spiked and he had to be put back on mechanical ventilation. And we're praying for Chad Horton. We're praying for his recovery, that he will soon be well. But this is just a very near and local example of how people are affected. If we were just to let the pandemic run, there would be many of us that would succumb to it. So just something to think about as you consider the official reaction. And I want to speak about this and just say it's easy to play Monday morning quarterback. It's easy in hindsight. The truth is, in most localities, in most parts of the world, at every level of government, our leaders have acted or reacted to this a little bit late. And I'm thankful that in our state and in our nation, we have some leaders that have taken it seriously. And albeit while we may have waited late to attack with some of these things, such as the shelter in place and the voluntary lockdown that we have here in Arkansas, thankfully that we have it ongoing to protect and provide for the welfare of our people. Our government passed a very, as you well know, a very large relief bill. A lot of debate back and forth for several days. They passed this, and no doubt many of you will receive a check or something direct deposited to help you through this. And it's just impossible to put one's minds around it. But I think it's clear that our nation is probably headed to recession, and perhaps a very deep recession. Ironically, this morning, economists were expecting jobless report this week, or new jobless claims, to be around 1.5 million. The truth is that as of this morning, it was over 3 million and climbing. So a tremendous hit in our economy. Now, I want to talk to you about the national outlook for the United States. And this is just a quick skim of headlines from reputable sources, places and reports and news sources that we believe that we can trust. And this is just a little bit. First of all, I don't have any really good news to share on this front tonight. The United States has now passed China and Italy both for the number of active cases, and very likely is going to pass at some point in time in the total number of deaths. Hospitals across the United States, listen, this is a headline from this morning. If this does not sober you up, and I'll just mention this brief aside here, I've moved in these updates from trying to warn people and trying to get people to take this seriously to just reporting what's going on. Friend, if you're not taking this seriously, if you're not taking precautions personally to protect yourself and others, I don't know what it would take, and that's just between you and the Lord. But as for me and my house, we want to not only serve the Lord, but we want to serve our fellow man and be proactive. And that's what I want the Testimony of Friendship Baptist to be. I want us to be proactive in every way, not only protecting our own, but protecting all of those around us. But this is a headline from one of our leading newspapers this morning. Hospitals across the United States consider universal do not resuscitate orders for coronavirus patients. This is an area of medical ethics that's being hotly debated. Do we resuscitate someone if they get to that point near the end? You say, why in the world would a nation like ours, with all of our resources, be at this point? Because the pandemic is going to overwhelm and already is overwhelming in some points and places in our country. It's a tidal wave, ladies and gentlemen, that is still rising and yet to hit with a full force, to crash on our shores. And so we need to be praying for all of these doctors and others going to be making these decisions. Another headline from this morning, Pentagon orders halt overseas movement for U.S. military over coronavirus. Defense Secretary Mark Esper has issued a stop movement order to the U.S. military, halting travel and movement abroad for up to 60 days in an effort to limit the spread of coronavirus through the ranks, the Pentagon chief told Reuters on Wednesday. That is, our Defense Secretary has ordered to stop basically for 2 months now, that our military is, as it were, frozen in place because of the fear of the spread of this virus. This morning from the New York Post, more than 300 cops have tested positive for the coronavirus, with many more awaiting test results for COVID-19 as the illness continues to spread, through the New York Police Department, officials said Thursday. And by the way, there was a 36% increase in just one day of New York City police officers testing positive. Last night, interesting here, and also kind of alarming, last night New York City EMS took 6,406 medical 911 calls, the highest volume ever, even surpassing 9/11/2001. And then another headline, this time from the West Coast. Infectious disease expert says nearly half the patients at San Jose Kaiser Hospital have coronavirus. He said literally the entire hospital is being turned into a COVID-19 hospital. Half the patients, 242 beds, and half of them are either tested positive or in testing now and likely to be in need of almost 100% of a hospital dedicated to fighting this virus. Now I want to just share just quickly on the international outlook. Of course, in our world, it's a large world. It's a big country. A lot of things that we could share. These are just a few. Russia, of course, like governments in China and some other countries, we don't hear a lot from them. We don't know a lot's going on, but we do know that the Russian government has allocated now billions of rubles to establish 16 gigantic field hospitals in anticipation of what's coming. In South Africa, the numbers are beginning to soar. There's great fear of what's going to transpire there. Spain and Italy, and this is again alarming, but Spain and Italy, very hard, the two hardest hit countries in Europe. Their death rate continue to rise. And here's what is, I think, particularly disturbing for the very hard-hit Lombardy region of Italy. This is up in the very far north. They had thought that perhaps they were nearing peak infection rates and maybe begin to flatten that curve, as they say, and begin to bring on downhill side, but now they reported a surge of 2,500 new cases in this past week, and so that's very, very alarming. One interesting thing, though, and I hope that we can maybe take this in consideration as Americans as we deal in many states now where it's mandatory, this lockdown or shelter in place. I repeat that our governor has still here begged and implored not only the governor but other health officials that Arkansas residents will begin to practice and take these steps so we do not have to be mandatorily told what to do. But northern Italy is extremely high infection rate. The case fatality rate there is very high. But the southern two-thirds of Italy, where they have taken more proactive measures after seeing what began up north, are actually much better off than the northern regions, showing, and there's many countries in the world that are demonstrating that if people will shelter in place, if they will limit their contact with others socially, work-related or whatever, that we can begin to put a dent in the spread of this. Now I want to come just quickly to Arkansas. I did not get to see, there were some YouTube channel issues today, I did not get to see our governor's regular update. I'm going to try to see it after we do this broadcast this evening, and but I will say that I did see about 7 or 8 minutes of him speaking today to a special session of our legislature. What was unique about that was the first time, I believe, in Arkansas state history that the legislators met for session in a gymnasium. I don't know what gym, I didn't catch where it was there in the Little Rock area, but they were in a gym where people could be spread out and not be close to each other as they normally would, were they meeting there in the Capitol building. The governor also and health officials with the state have requested that anybody that's returning to Arkansas from New York State and or international places self-quarantine or self-isolate for 14 days. There is great concern with what is going on in New York State, and a very high infection rate there. It's an international hub that many New Yorkers are leaving and going to other parts of the country. And so there's great concern there. There's great concern with Florida for many reasons. Not only did Florida host thousands and thousands of college spring breakers in the last 2 weeks, many of them who absolutely laughed and disdained any request to social distance and to avoid contact, now have returned to many states across the country, but also Florida is seeing an influx of people from New York and other places, so that's definitely going to be a place of great concern. As of earlier this afternoon, there's 335 cases. They continue to mount exponentially here in our state. A third person has died now in central Arkansas. But I want to remind you something about testing in our state. I believe I'm speaking accurately here. We don't have a clue how many positives there are. because the only people that are being tested basically are those that are showing symptoms of COVID-19. So that means there's many asymptomatic and or pre-symptomatic people that are not being tested. And I know that many of several individuals from Friendship Baptist Church have been exposed at work or somewhere inadvertently. And the truth is, any of us, basically, unless you've been living by yourself and hadn't had human contact the last 14 days, any of us could have been exposed and maybe just haven't begun to show the symptoms yet. The number of people hospitalized in Arkansas with COVID-19 has tripled in one day, also tripled in the number that are requiring mechanical ventilation. Again, this number, unfortunately, is expected to increase greatly day by day. I want to say something real quickly about Senator Cotton. I got to hear him speak this afternoon, and I'm going to echo this again, as I've said from the beginning when I began to do these. Senator Cotton was, if not singularly, one of the very first public officials in the United States government that was warning about the danger of a pandemic, that was warning about what China was doing, was warning about a cover-up, was warning about the necessity to stop air travel. In fact, I think he was one that probably had a lot of influence on President Trump when he preemptively began to stop travel out of China and other places. Our president took a lot of heat. The very same people that earlier had said, there's no need to stop it, they criticized our president, they mocked our president when he stopped air travel in China, the very ones that now are saying he didn't do it soon enough. But I want to tell you, Senator Cotton has been on top of this from day one. Senator Bozeman, our quiet senator, they've been working together and done a tremendous job. But I want you to listen to some thoughts that Senator Cotton shared today. First of all, he said, note there are over 72 million Americans who are over the age of 60. That is the demographic that's most affected most seriously by the COVID-19. 72 million Americans. Of this group, millions of this 72 have underlying health conditions, which is natural and normal the older you get. So what I'm saying here is, again, if we allow this pandemic just to keep our economy, everybody keep going to work, everybody keep coming to church and meeting together, socializing, let's keep playing ball games, doing all of that, you could take that 72 million and probably take several million of them and just put an X through them or X by their name. No, we wouldn't know who, but over the course of time would likely die. And certainly we're trying to cut that down. But here's another thing that's very sobering. In the cases that we know about, even in New York City, there's a high number of cases between 19 and 49. Now, many of these do not become as critical perhaps as some of those with either underlying conditions or the older population are. But 1 out of 7 of young people that's stricken by this requires hospitalization, and we do know of a number of cases that people are very seriously ill, and I mean have even died, that were young adults that had no previous condition. Thankfully, that's rare, but nevertheless, it is distressing. And I also want to share something that's alarming, and we just need to be praying super intensely and fervently for those of our number who are frontline healthcare workers. I listed, I think, most of ours the other evening. One of them that I overlooked was Miss Caslin Sifford, who's also a nurse and caring for critically ill people. But our healthcare workers all across this nation are dealing and putting their lives on the line to perform their duties. And I just say that we must pray for them. Not only is this a serious risk for their health to care for these who are suffering and infected with this virus, but when they themselves become infected, it's taking some critical people off the front lines for a period as they're quarantined and themselves often battling and even being hospitalized. What an amazing thing. Those that are life and health care providers themselves requiring life-saving care in many instances. Now we'll just kind of wind down by just saying, I know that for our nation and our people, this is an opportunity for innovation. And I know there's many entrepreneurs, there's private companies, individuals that are working and figuring out things, whether it's studying for a vaccine, whether it's providing masks and personal protective equipment, whether it's filling some gaps where there's need. I know a lot of people have been laid off, but I know also, like I was told recently in Batesville, and I don't know about Ash Flat at our supercenter here, but in Batesville, at Kroger's, Walmart places, they're hiring. They need people to fill the gaps, but American people are innovative, and I'm grateful for that. We've probably not seen an effort like this nationally since World War II, where the civilian public is required to step up and adapt and literally go on a war footing. And one of the things that this instance has showed us is the necessity for America to keep our supply chains at home. And I know there will be time for political debate on that, but I think we're seeing as a nation how critical it is where we have farmed out through the years so many things overseas. And so I want you to continue to pray, be optimistic. And now I'm down to my last page. And this is partly one of the most sobering parts here, but I'm just sharing from my heart. I'm not any kind of expert. I'm simply a country pastor, but he loves his people, and I want to be able to be a blessing in every way we can. One question that is often mentioned or people discuss is how long this will last. What will be the duration of this? Our president said that he hoped by Easter Sunday that our nation was ready to go back to work. I will share with you my thoughts on that. I don't think there's any way this is going to be over by then. I certainly hope I'm wrong. I hope that he's right. I think maybe he was wise to share that just to give hope. That's one thing leaders do. They inspire and give hope. I'm afraid that it's going to last through that. We're going to continue as your church family, church staff, to be adaptive. If you've not already begun to listen to Brother Smith's podcast, he put his first one up yesterday. You can go, I think, to our church Facebook page. Those of your members, contact Brother George, our church office. He did a tremendous job. I'm excited about how the Lord is going to use that to be a comfort to people. We have other pastors and evangelist friends of our church. I've requested them to work on maybe some messages that they can video that we maybe could post. They don't have to be maybe the normal length they would preach. Maybe it's just a lesson they want to teach that, and we want to be proactive in trying to get things to you to be an encouragement and help. I think it's imperative that we continue to adapt and adjust in everyday life. This is not going to be short-lived. And that leads me to this. The end of this COVID-19 pandemic, as it directly affects you and I, our families, our vocations, our church family corporately meeting, is going to be a ragged end. And what I mean by that, it's not going to be a clear-cut date. We're not going to be able to say, well, on April 15th or May 4th, everybody's going to be back. It's going to happen at different times from different places. I'm prayerfully and hopefully optimistic that maybe in the rural area that we live, if people will follow protocol, if they'll self-isolate and quarantine if necessary, that we can avoid becoming a hotspot, one of those bright spots on a map. If you look at the maps that cover the United States and show where outbreaks are, there's some hot spots not very far from us. But we don't know when this is going to be resolved. We will be updating, Lord willing, every day to give you maybe our thoughts or the latest news on this. We're hoping that there's some things developed medically, professionally, and most of all prayerfully, that God will give us a time to get back together sooner rather than later. There's basically 3 steps to containment, and that's where we are to mitigate this right now. We can't avoid it. Number 1 is this matter of isolating, maintaining social distance. Again, it's going to be a phrase and words that enter our vocabulary for the rest of our lives that before we never thought about it, but we must maintain that. We cannot take our eye off the ball. We have to understand cause and effect. You cannot wait till the train is coming at you in the tunnel, folks. You have to be proactive every day. You need to be careful of things that you touch. You need to remember this right here. And you say, Pastor, we're tired of seeing that. Always good to have a daily reminder. And I want to say, don't be this guy or gal. Don't be the one that says, it won't happen to me. Prayerfully, it won't. I hope it doesn't happen to me. But I have enough wisdom to know that I can't say that I may not contract this, or that you may not contract this, but I think we're beyond this. I hope we are. Don't be in a state of denial. It's okay to acknowledge what we're going through. In fact, it's wise to do that. To be in a state of denial is to be willfully ignorant. It's to harm those around us that depend upon us for protection. Let's just be honest and open about it. We talked last night about fears and how we deal with that, and how that spirit of fear is not of the Lord, but it's of Satan. I want to just close by one admonition and then just one phrase from a beautiful hymn. Be careful in these days and thoughtful about what you listen to and what you watch and what you let come into your mind and into your heart. I know for a fact there's more preachers, this one included, that are on either YouTube or Facebook or live streaming somewhere, somehow, some way, that have ever been in human history. There are going to be those who will take advantage during this opportunity. And one thing that we're going to have to watch for is going to be a proliferation of false doctrine. There are going to be people who are going to try to take the events and the fear that these events are producing in men and women's hearts, and they're going to try to draw followings after them. You remember, any true preacher of the gospel of Jesus Christ is not going to exalt himself. He's not going to draw men to himself, but he will always, every time, first, middle, last, point men and women, boys and girls, to the Father in heaven, to the Lord Jesus Christ, by the power of the Holy Spirit. And I close with this phrase: turn your eyes upon Jesus, look full in his wonderful face, and the things of this earth will grow strangely dim in the light of his wondering grace. God bless you. Lord willing, we'll see you tomorrow. Have a good evening.